Phospholipase A2 converts membrane phospholipids to arachidonic acid. Membrane phospholipids are converted to arachidonic acid by phospholipase A2. Phospholipase A2 converts membrane phospholipids to arachidonic acid, and it has two fate. There are two enzymes. One is LOX or lipooxygenase. Lipooxygenase converts arachidonic acid to leukotrienes. LOX will convert the arachidonic acid to leukotrienes. And COX. So COX, there are two types of COX, COX-I and COX-2. COX stands for cyclooxygenase. So arachidonic acid पे दो enzymes can act, COX or cyclooxygenase and LOX or lipooxygenase. LOX will convert arachidonic acid to leukotrienes. COX, there are two types of COX enzyme, COX-I and COX-2. See, COX-2 is also constitutively found in brain and kidney. COX-2 is found constitutively in brain and kidney. It is induced during inflammation by cytokines and inflammatory mediators like endotoxin. तो COX-2 भी दो टाइप का है, या तो वो इंड्यूसेबल होगा, इट इज़ इंड्यूस्ड ड्यूरिंग इन्फ्लामेशन बाय cytokines and inflammatory mediators like endotoxin. Cytokines and inflammatory mediators will induce COX-2, or COX-2 is also constitutively found in brain and kidney. COX-2 is constitutively found in brain and kidney. COX-2 is induced during inflammation by cytokine and inflammatory mediators like endotoxin. Now COX-1. COX-1 is constitutive and is found in most tissues such as blood vessels, kidney, stomach and platelet. COX-1 is constitutive, found in blood vessels, kidney, stomach and platelets. COX is the enzyme responsible for the biosynthesis of prostaglandins. Okay, so PGI2. PGI2 causes vasodilation and inhibition of platelet aggregation. PGI2 causes vasodilation and inhibition of platelet aggregation. PGF2 alpha lowers intraocular pressure and it is used in glaucoma. PGF2 alpha lowers intraocular pressure used in glaucoma. PGI2 inhibits platelet aggregation, so it is used during hemodialysis, and it is also used in pulmonary hypertension. PGI2 analogs are used in pulmonary hypertension, and because it inhibits platelet aggregation, it is used during hemodialysis. PGF2 alpha reduces the intraocular pressure. PGE2, GI protection, platelet function, kidney function, regulation of blood flow. So PGE2 has GI protection. GI protection मतलब ये म्यूकस की सिंथेसिस को इंक्रीज करेगा, एसिड के सीक्रेशन को कम करेगा, जिसके कारण पेप्टिक अल्सर जल्दी हील होता है. It also has platelet function, kidney function and regulation of blood flow. PGD2, it causes vasodilation, PGD2, D for dilation, and it causes bronchoconstriction. PGD2 causes vasodilation but bronchoconstriction. Vasodilation but bronchoconstriction. Thromboxane A2, it causes platelet aggregation and regulation of blood flow. PGI2, inhibition of platelet aggregation and vasodilation. PGF2 alpha, it decreases intraocular pressure. PGE2 has GI protection effect. PGD2 causes vasodilation and bronchoconstriction. Thromboxane A2 causes platelet aggregation and regulation of blood flow. Okay, and COX-2 is found constitutively in brain and kidney, and it is induced by inflammation it is induced during inflammation by the release of cytokines and inflammatory mediators. PGI2, PGE2, PGI2, thromboxane, other mediators like tissue necrosis factor alpha, interleukin and bradykinin, they they cause pain, inflammation, and fever. The, in these cases, the prostaglandins will cause pain, inflammation, and fever. So, the non selective COX inhibitors will inhibit both COX-1 and COX-2. The selective COX inhibitors will only inhibit the COX-2. So, this was about COX and LOX, about prostaglandins.